So you mentioned those doctors that you have to talk to at insurance companies?
No.
Yeah.
So I've told you about 5 to 7 days, 5 to 7 days. Day 1, they got to be very sick. Better be sick. Day 2, you better still be sick. Day 3, little better. Day 4, if they're too better, out. If they're not better enough, you get some feedback. Day 5, if I decide that the pacing isn't quite right and I need to slow it down, I'm now going to incur the ire of the insurance companies. Day 6, I'm going to be on the phone with what's called a doc-to-doc. So here's what doc-to-doc is. Every hospital has a team of people dedicated to interfacing with insurance companies to assist hospitals in collecting the monies from the third-party payers. Our insurance utilization folks will call me and be like, you got a doc-to-doc, man. If the hospital's gonna get paid, you're on that phone call. And I'll get on the phone with a doctor at one of these insurance companies, and they say, okay, this is a utilization review for patient Sam Smith. This is a 30-year-old with depression who's been in the hospital for 6 days, and you've done this, that, and the other thing, because they get all the notes. That's another interesting thing, that they get all of the clinical notes from the hospitalization. So they're sort of like, again, peeking in to the treatment process. So they've reviewed the notes and they know exactly what the med's on. They know the vitals for the day, and they say, he told you about his uncle who committed suicide last year, and now we're on day 6. What's your plan? And I say, well, I was going to do blah and blah, and I was going to think about adding this medication or taking away that medication, and I was in the process of working on this, then. And they say, thank you very much. Anything else you'd like to add? Yes, no, maybe so. And then they render offline a decision as to whether or not the insurance company will pay for further days based on medical necessity on the inpatient service. If they don't pay for further days, there's an appeal process, and that appeal process goes to another company. And then the appeal process has 1, 2, 3 typically people, another doctor, a nurse, usually the original doc, or someone else from the insurance company. All the calls are recorded, and they say, okay, now we're at day 8, because at day 6 I had that conversation, and they stopped paying at day 6. And they say, I understand you've kept the patient in the hospital 3 additional days. What's been the reason, rationale, protocol? I explain it, and they say, well, we appreciate all that you're doing for the patient, but we're not going to pay for it because we don't think it's appropriate. So day 6, 7, and 8 are all then paid for by the hospital. The hospital loses money when hospitals provide what I would describe adequate care for patients. I would say they're incentivized to adhere to 5 to 7.